Thank you so much, Mr. Chairman. And I'm so honored and excited to have the Secretary with us, as having had him as a mentor when he was a member of the House. To see him in this position and know the leadership that he's going to bring to the agency is something I know that we're all looking forward to. Mr. Secretary, I had a number of questions for you, and just wanted to summarize some of those related to the territories, and hoping that you could give your commitment to work with our office and the other territories regarding healthcare disparities. As I'm sure you're aware, the territories are again in limbo as they face the upcoming fiscal cliff in Medicaid programs at the end of this fiscal year. The administration has done a great deal, and this Congress has supported the territories in eliminating the disparities that we have, not only in our funding caps, as well as in the share between the federal government and hospitals and local governments as well. But also, and one that we don't talk about as much, is the exclusion of the American residents living in territories excluded from low-income subsidies for Medicare prescription drug benefits, as well as to the disproportionate share per hospital's DSH program under Medicaid and Medicare, in spite of the significant amount of uncompensated care and the number of individuals in rural areas in the territories. And I was hoping that you would look at some of these issues and make a commitment to work with my office as well as other territories in this committee to find permanent solutions to some of those disparities.
Congresswoman, first, great to see you. Secondly, it was great to actually see you in person just a couple of weeks back, and I look forward to getting to do that more often. Let me tell you, I think you know from my work when I was a colleague that the territories deserve to have our attention. You know that the president's budget has support for eliminating the Medicaid funding caps for U.S. territories and tries to make sure we can align matching rates with states. And so I look forward to working with you because folks in the territories work very hard. We have to match that work effort to make sure we can address these needs.
Thank you. The other question I have is with regard to temporary assistance for needy families, TANF, in particular the national TANF issues. Do you believe that TANF funding levels or allocation of funds to states should be altered to account for changed circumstances, inflation, poverty, population? What are your thoughts with regard to funding levels and allocations of TANF?
Congresswoman, TANF is a program that's supposed to meet the needs of our neediest families. And so we have to make sure that whatever our statutory framework is or anything we do through regulations, it's directed at trying to meet the neediest families. Every once in a while, that means you probably have to make adjustments so that you refine your approach. And so we're more than willing to work with you and others if you think there's a better way to do this, because we want to make sure at the end of the day, our resources are reaching the most needy families.
Well, I know that this has been an issue during the pandemic as work requirements and time limits on aid, should some TANF rules be suspended during the pandemic? But then once the pandemic ends, should those changes be made to work requirements to prompt states to engage additional unemployment recipients in activities? Or should the changes be made to alter the share of eligible families receiving assistance? Did you have any policy ideas or thoughts for this Congress on how we address the most neediest families in our country?
Congresswoman, I know the time has expired, so I'll simply say this and we can follow up. We want to work with you. If you think there are ways that we can move forward to address the needs of these families post-COVID-19, we're willing to work with you, and we look forward to seeing if there's some good solutions.
I thank the gentlelady. Let me recognize the gentleman from Pennsylvania, Mr. Schmucker, to inquire.